have been planning these distributions throughout the city with all our high rises. This was already on the schedule, and then we found out that the governor wanted to have a press conference. We welcome him here today. Governor McKee, Lieutenant Governor Sabina Matos, Director Mark Pappas, who's in charge of the EMA for the state of Rhode Island. We welcome you and the rest of the team, Dr. McDonald and everybody else. So thank you all for being here, and Governor, I'll turn it over to you.
Thank you, Mayor, and thank you for your leadership. Being here today, having cameras here, seeing residents receive test kits and masks, it delivers a great message around the whole state of Rhode Island, because not only is Mayor De Silva really stepping up with his team, but also municipal leaders around the state of Rhode Island are doing the exact same thing. So getting that message out, how important it is to be tested, wear your masks, and get your booster shots. It's just a great spot to be here. We love getting our feet on the ground. I think it's really important to do that. So following this morning's announcement that Dr. McDonald will assume the day-to-day responsibilities of the Department of Health as the Department of Health Director, we wanted to get out in the community and start introducing him to some of the municipal leaders and partners that have been supporting our COVID response, over the last almost 2 years. I would also say that, when there is a change of leadership, it's very important to get the leadership that's going to carry us forward out in front of people. We thank those who have been in leadership as well as Dr. Alexander Scott, but we want to make sure that the people know that we've announced an experienced bench of leaders to support Dr. McDonald. Anna Novas, former Assistant Secretary of the Executive Office of Health and Human Services, and experience in the Department of Health. My Deputy Chief of Staff, one of our Deputy Chief of Staff, Pastor Chris Abeling, he's been helping in many areas, and he's going to take an early spot in the Department of Health, so that we're making sure that the transition goes smooth and that there's a good communication between our office and the Department of Health. Along with Ernie Almonte, Chief of Staff of the Lieutenant Governor, former Auditor General, and it's great to have a partner like Sabina that we saw a need to have someone like Ernie there on assignment, and so we're working that out in our offices. But it's another value, quite frankly, of a Lieutenant Governor and a Governor working like this. So thank you, Sabina, for making that happen. And I have full confidence in this team and look forward to continuing to work with them. We'll be back on Tuesday afternoon for a full COVID briefing, but I do have some important updates regarding COVID to share with you today. On the rapid tests, today we're in East Providence, where rapid tests are being given out to our seniors. This is part of an initial 500,000 tests that the state secured a couple of weeks ago, and I was in Johnston outside in the cold weather on Saturday, handing them out just like we're providing these important test kits and masks to people here in East Providence today. But a big thank you again to Mayor De Silva and our municipal leaders for moving fast to get these test kits out the door. This is a very appropriate location to announce tomorrow we'll be distributing an additional 500,000 at-home rapid tests. And thanks to Director Mark Pappas for his assistance in making this happening in a way that is going to really be important to the people in the state of Rhode Island. So just like the first batch, about 70% will go directly to the cities and towns of that next 500,000, and 30% will go to community partners in the health equity zones. This means that in about a month, right around a month time, 1 month period, 1 million at-home rapid test kits were handed out into the communities, all 39 cities and towns in the state of Rhode Island. On the boosters, this is going to be a real focus for us over the next several weeks, is the booster shot. So right now, about 35% of all Rhode Islanders have received a booster shot. That's not enough. And we want to do much better than that 35%. And I know that we can get there. So we're going to really make sure that, just like when we were getting people vaccinated during the summer months last year, where it was an absolute top priority, and we made it that way with different levels of efforts to make sure that we were getting the message out. We're going to do that again, and one of Dr. McDonald's top priorities is going to be coming up with new strategies to get Rhode Islanders boosted. On the case numbers, I also want to briefly share encouraging news. Our 7-day case average is beginning to decline. It's down about 48% from a week ago. And also our 7-day average for percent positive is also down from 18% last week to about 14% this week, and yesterday we were about 9%. On a national level, I want to give a little illustration of what that means to Rhode Island. So during the months that the Delta was first arriving, we were in the bottom 5 on infection rates and death rate, hospitalization rates. Today, we're in that middle of the 30s, 35. We want to be at the best. But I can tell you that the infection rate is going down, and I want to thank Rhode Islanders for doing the right thing and helping us, move this needle. Before I turn it over to Lieutenant Governor, I just want to let Rhode Islanders know that we're monitoring the snowstorm very closely. I was on a call with the National Weather Service about an hour ago, and we have another storm briefing call right after this press conference. The update at this time is that everyone is still monitoring the storm, and the models show that there is potential for a good deal of snow that will fall on Saturday, but we'll have a better sense exactly the track of the storm tomorrow morning and throughout the course of the day. And of course, we'll stay in touch with everyone in terms of the storm prep and what that means for Rhode Islanders.